Tonight in the Fox Focus, exclusive new information about the risks of laser eye surgery.
Fox News Chicago has learned of some potentially damaging allegations against one of the world's leading producers of surgical laser machines. Mark Saxenmeyer joins us now with the results of a 2-month investigation. Mark.
Nancy and Robin, in our effort to find out why the results of laser eye surgery are sometimes wildly unpredictable, why so many people have to be retreated, and why others end up with damaged or destroyed vision, we focus in on a lawsuit targeting one of the world's most prominent eye care leaders. This company makes a laser that some are calling unsafe, even dangerous. If you've had or have considered laser eye surgery, this is a laser you might want to ask your doctor about.
Just stare right at that red light, and you hear the buzzing sound of the laser.
There are only half a dozen laser vision correction systems currently in use in the United States. At this eye surgery clinic in West Suburban River Forest, Dr. Kirk uses this one called LadarVision.
How much do you attribute a successful laser procedure to the surgeon and how much to the machine?
The machine gets most of the credit when it comes to that because it actually does the treatment.
The LadarVision laser is made and marketed by Alcon, the second largest provider of laser systems in the U.S. According to its website, Alcon's lasers are currently employed in at least 20 different Chicago area eye surgery centers. There are hundreds more in use worldwide.
These machines have serious problems.
Attorney Doug Harris represents this man, Mark McDaniel, the CEO of EBW Laser in Greensboro, North Carolina. 4 years ago, McDaniel bought 10 LadarVision lasers from Alcon and leased them to laser eye surgeons across the country. Yet within months, he says, several of those surgeons started complaining.
They were not getting the intended result. In other words, you'd put in a certain correction and it'd be way off.
In hundreds of cases, McDaniel alleges, patients treated with lasers he bought from Alcon ended up with vision far worse than before surgery.
These people were seeing double vision, halo, glare, couldn't see at night, this sort of thing.
As a result, Mark McDaniel says he is suing Alcon, alleging deception and fraud. Although Alcon has responded, categorically denying the allegations, the case is headed for trial.
A number of machines started malfunctioning, and by malfunctioning I mean that people were having to have retreatments. They were having to come back for a second or even a third procedure that should have been only one procedure.
To support that assertion, Harris has just obtained the testimony of Morris Waxler, the former U.S. Food and Drug Administration Chief of Surgical Devices. In a report Waxler prepared for his deposition last month, he wrote, quote, "As one of the FDA officials who is in charge of the Lasik approval process, I can testify that FDA would not approve a Lasik device with a retreatment rate that was much higher than about 10%. Yet based on this internal Alcon document obtained by Fox News Chicago, Waxler has testified that these numbers clearly indicate nearly 60% of Alcon's lasers had retreatment or enhancement rates above 10% in the year 2002 alone. In fact, the same document indicates nearly 3/4 of the LadarVision lasers in use in the Chicago area that year had rates well above the FDA approval figures. This information prompted Waxler to assert that Alcon has, quote, failed to provide continued reasonable assurance of the safety and effectiveness of the LadarVision system.
These are serious violations, and we've learned since that there were many other doctors around the country who stated similar concerns to Alcon.
Our enhancement rate on that laser, has run as high as 25%.
This never-before broadcast tape was recorded by Alcon officials during a conference call in October 2002. The tape, which was produced in Mark McDaniel's lawsuit, records half a dozen U.S. eye surgeons discussing their concerns about the LadarVision laser with top-level Alcon leaders.
We've had enhancement rates that exceeded 30%.
My enhancement rate at one point in time was approaching 40%.
I've gone through my entire treatment profile, everything I do, everything I touch, trying to see what was the problem. And as it sits right now, I'm not comfortable, and I want you to understand that.
I mean, the worst problem of all is those patients who lose a significant best-corrected vision, and we don't have a good explanation for it.
Clinical results from our LadarVision systems are frequently unpredictable and many times at least appear to have caused the problems with patients' vision.
I mean, this cannot be labeled as user error. It can't be. It just can't be.
I would concur with everybody else saying that this is a laser that at any given point in time, you cannot exactly rely that it's going to give you the results that you want.
Of the 5 doctors heard here 2 years ago, Fox News Chicago has determined only one of them still uses an Alcon LadarVision laser today.
I just want to thank all of you for such short notice, putting the time in to discuss these issues, which we take very seriously and will work on.
Yet according to Mark McDaniel's lawsuit, Alcon never did effectively work on the issues discussed during that conference call, even as still more ophthalmologists expressed concerns.
The problem is among quite a few surgeons around the country, probably something like between 50 and 100.
Surgeons who performed operations resulting, Harris says, in thousands of adverse outcomes and complications nationwide.
I think the evidence is very strong.
Fox News Chicago has obtained copies of dozens of documents produced in the McDaniel lawsuit, including emails sent by other LadarVision using surgeons to one another. In one, a North Suburban Chicago doctor writes, quote, Alcon has heard these complaints from everyone. They know they have problems, but they cannot afford to give everyone their money back. They pretend to be surprised, but how could they be? In another correspondence, a different doctor writes, quote, I stopped using the LadarVision platform after 4 or 5 months of extremely variable results. The company's stance was defensive and unproductive.
They'd hide it and they'd cover it up.
Yet some doctors who use the LadarVision lasers say these complaints are news to them.
This is the first I've heard of that. I hadn't read it or heard about it.
Dr. Kirk is one of many surgeons who stands by the LadarVision laser.
There's just no way I would use a laser if I was getting results that weren't what I felt would be the best results, no matter what you paid for it. I mean, if there's a problem, you stop right now and get a different system in.
Yet this same Alcon document indicates Dr. Kirk performed 489 procedures with his LadarVision laser in 2002, and that 95 of those were retreatments. That's a 19.4% retreatment rate, nearly 10% above the FDA approval rate.
The numbers you see there don't correlate.
Dr. Kirk says some of the people who needed retreatments in 2002 had their original surgeries performed years earlier or with a different laser.
That may skew the data.
Regardless, Dr. Kirk says,
if a person's not happy with their vision and I can make it better, I'll do it. There are a lot of people out there that may have a much lower enhancement rate who put their foot down. If you're seeing better than 20/40, you're done.
Officials at Alcon declined to be interviewed by Fox News Chicago for this report and instead provided us with this statement, quote, the LadarVision 4000 is safe and effective as determined by the US FDA, other regulatory authorities around the world, and numerous peer-reviewed articles published in respected medical journals. The allegations of high retreatment rates are false and inaccurate and are not supported by any scientific or clinical evidence. These allegations are based on the invalid claims of 2 parties who have been sued by Alcon for non-payment of legitimate multi-million-dollar debts. If indeed so many doctors are truly concerned about Alcon's LadarVision lasers, shouldn't the current leaders of the Food and Drug Administration be investigating? A spokeswoman for the FDA tells me, quote, we are aware of the complaints about this product and we are in the process of looking into it. I am not at liberty to disclose any of the details of what that involves, end quote. Robin and Nancy, this is a story we'll be following.